So I want to just speak to sell for a minute because I struggle, and I think most healthcare providers do struggle when we come out of the conventional system. We're not marketers, we're not business people. We are uncomfortable asking for money. And I really wanted to, out of the gate, have something that I could offer that included insurance. I wanted to work with,
Mhm.
Medicare pay. Like, how do I set this up in a way where I can make it basically free to you and I can just provide you the thing that I think has value?
Which makes people not commit.
True. Let's talk about it from both sides.
Mhm.
So from the provider perspective, talk to me a little bit about your experience because you've worked with, I mean, thousands at this point, right? Providers who have made this transition.
Well, I've worked with cash pay. I've worked with people. When I was working with doctors in Palm Desert, we had one doctor who did all insurance based, and the other doctor, there were two doctors that like were very similar in what they did. One was taking insurance and Medicare and everything else, and the other one was taking no insurance, all cash pay. The insurance guy goes, "They will not pay for this, in this town and blah, blah, blah." I'm like, "He's 2 blocks away from you, and he's killing it." And you're talking Palm Desert, where there are more millionaires and billionaires than like, I think maybe we've got Palm Beach and Naples. So the the challenge with the insurance-based people is you commit with time and money. If you're coming in and you're gonna see what insurance will pay for, and that's how you're gonna make a decision on your health.
Mhm.
And most of the time, it's like, "Well, wait till this gets bad enough to do something about it." That doesn't make any sense to me. So then you see and one of my buddies was an integrative physician. He was an integrative internal medicine trying to practice that in an insurance-based model, but it wasn't working for 2 reasons. Number 1, he didn't have enough time with the patients to do it,
Yeah.
and then they didn't really understand what they were supposed to do because he couldn't really explain it to them, right? And then they also didn't understand why they need to buy other things that insurance didn't pay for because that was their mindset, like supplements. And literally 2 blocks away, I had another guy who was now killing it because he was doing transformation programs cash pay.
Mhm.
So I think it's the challenge is that you don't get that commitment. Now, we do have some doctors who are doing insurance, but they're doing it differently. What they do is they use insurance as, uh, whatever insurance will pay, they'll take that piece, but they do a membership.
Mhm.
So basically, the membership covers the extended visits and the different types of services and supplements and IVs and all the things that would never be covered by insurance, but the insurance covers some of the labs and the shorter parts of the visit, and that's how they'll do it.
I want to get to the consumer side of this or the patient side of this. But before we do, I want to speak to what a lot of my patients right now are looking at me and saying, well, you just sold your practice to a company with the goal of taking insurance. So we were in it was a niche, over $1,000 a month, a high touch point program, which is what I felt my patients needed. And it worked. I mean, it was successful. And that's why I'm very comfortable saying what I say about osteoporosis. But I also saw that there was nobody offering, even in the conventional system, there's nobody offering what would be so easy to do in a short visit. I think that if we could just educate the right number of providers and the right people from a bone health perspective, there is something that you can do in a 20-minute visit. That's our at Life MD, that's what we do. So in a 20-minute visit, there's a lot that you can offer that bridges the gap between what people want and what they're currently getting. And so that's why I made this move, because we can offer this to essentially, hundreds of thousands of people and do through this program what they need. There are some of those that are not going to be successful with that. And that's where you'll need a higher touch program. But I felt so called to take this to the masses in something that could be covered by insurance, at least the parts, just like that example.
So if there's pieces that are covered by insurance, the question is, are you getting the person who's committed to actually do it? Because the challenge with what you're talking about is it's very different than going to the allopathic doctor who's got 7 minutes and is gonna give you a medication
Sure.
that even then people aren't necessarily compliant with. But now you've got a visit where they are going to have to shift their diet and they're
Hmm.
going to have to shift their exercise, and that takes extreme accountability and motivation.
And more education. And this is where right now where we are is we have created essentially the drug path, right? And that's what LifeMD built their platform on, is a good way, a great platform to get reliable medications at an affordable price. So I saw that as an opportunity to say, okay, can we build a women's health program where they can get optimized hormones, testing, prescriptions, or they can't get otherwise?
Mhm.
So good experience. Now do this through the lens of bone health. Okay, now we have a bone health program, but then the lifestyle piece comes in. So this is going to be the experiment to see, can we do this at scale? How much lifestyle can we actually impart? And I don't know the answer to that yet.
Yeah.
But there will be also other avenues for them to go. There will be off ramps that will offer higher touch points. So this is going to be an interesting experiment and an interesting bridge to see what people actually need to be successful. Because not everybody needed our $1,200 a month program either. I think there's plenty of people that were in that program that if I just would have given them the right information, they would have been successful on
Right.
their own.
Well, there's people that will buy a book and actually read the diet book and do the diet.
Right.
They're the unicorns. And then there's all different levels that people need. And I
Yeah.
think part of it is going through and saying, hey, here's the different offerings that we can do. If you're very self-motivated, we're going to guide you through this. Maybe you have some trainings in your bank that they can do and you'll check in. But if you need more support, then here's the next level of it.
So then let's talk about that next level, because this is where, and I learned this from my wife. And you just said it well. People pay attention to what they pay for, right? This is, once you are invested, then you are more likely to be successful. And I didn't understand this as a doctor because people came to me, their insurance paid for our surgeries, right?
Right. Well, and they had to likely do what you were having them do. They didn't really have options,
They
did
had to
they?
get to the OR, yes. Now, the recovery, this was interesting, right? So if you had a recovery that involved participation, yeah, you could easily see those that were invested and those that weren't. And I think this is why there are cash pay orthopedic practices out there, which that's a really interesting business model, very expensive, but their outcomes are far superior. And why? Clients are invested. So help me to bring this back to the patients who are looking at programs like what I built
Mhm.
and charging, again, over $1,000 a month for. From the provider perspective, why is it reasonable to consider some of these programs, even though they seem like they're potentially wildly expensive? They seem like, gosh, shouldn't insurance pay for this? I, as a provider, created it because I think the outcomes are better in that environment. And currently, I would say that's still true. But you've worked with thousands of providers. So can you speak a little bit about cash pay versus insurance? Where do we actually see better outcomes for patients?
Most of the doctors that I've worked with have been in cash pay. We've had some insurance. The outcomes have always been better when people commit with their time and money. They're just more committed.
Mm.
There'll be outliers, but I think that there's more this moral obligation. Like you came into this business because you wanted to help people,
Mm.
heal people, right? I think of Dr. David Perlmutter. So what people don't know about David is he was one of the first people to go cash pay. So he's been a renegade in so many ways, which is pretty interesting because he's not a contrarian person by nature, but what he's done has been so.
Mhm.
So here he is in Naples, Florida, and he decides he's going to leave his neurology practice. He's going to go create a cash pay office. They told him, "We will never send business to you."
Mm.
And they didn't, but the whole town did. Now he has a cash pay practice. And not only has he done that, but he also believes that what you eat affects your brain. Totally crazy, right? Like brain, crazy. But what was so interesting was what he was able to do because he is like the kindest human you'll ever meet. And people who came in and were like, just can't afford it, he would scholarship them.
Mhm.
He'd have them pay what they could, which he could do because of the way he set up his business model. A hybrid model is possible. For a lot of offices, it makes it more complicated and complex and more difficult.
Yeah.
So you have to be aware of that one too. You have to be really clear when you set it up, the membership part of it, and then the insurance part of it,
Mhm.
because it can get a little bit unclear.
And really careful too if you're thinking about CMS, Medicare, Medicaid.
Yes.
You can get in trouble if you start billing incorrectly there.